you spoke about. Migraine, tension headache, and you would get clusters also going to the general practitioner. But the person, to the individual, to the patient, to the man on the street, when he gets a headache, he doesn't know it's a primary headache or a secondary headache. I mean, those are concepts we come up with to confuse people, right? To that person, he's got a headache. So he calls it simple if it responds to the over-the-counter medicines, meaning your Panados or your whatever, Stopains or whatever you take, right? When it doesn't respond, then he goes to the general practitioner, who then decides through his examination and all of that, is it still just a simple headache? And then he'll adjust the treatment to help. When that doesn't work, after a few days or a week or 2 weeks, that's when the referral to a specialist goes. Or if that so-called simple headache becomes complex, in the sense that with the headache, you now have fever, you have neck stiffness or pain in the neck, you have, like Dr. Shevel was alluding to, other symptoms, numbness in the hand, weakness on the one side, symptoms that would say to the doctor and the patient, something's wrong. It's more than just a headache.
Okay, can you safely say most of the headaches that people have and that they even treat at home are related to fever, you know, to colds and flus and those kind of things? And it is your common cold and all of those influences that lead to most of the headaches that people come up with, including children. Would I be right to say that?
More or less. Yeah, I mean, one wouldn't disagree with that. That's probably the commonest reason for headaches. That, and in our world today, probably the tension headache is increasing, even though your insert implied that it's less common than migraine. I think it's becoming more common because of the stresses.
Okay, so tension headache is caused by what?
Tension headache, we don't actually I can't tell you what it's caused by because we actually don't even understand it. What we know is it's a headache, in the sense that there's pain in your head, right? It's mostly associated with tenderness and spasm of certain muscles. These, which we call the temporalis, and those, the nuchal or the cervical muscles.
They become tense and tight.
They become tight and tense. And that's the most consistent finding. You see, headache has been with us as a human race or as a species forever. It's not something that either of us have discovered, or it's not something new. If you go back in the history of mankind, it's always been there. You see what I'm saying? And over the years, we're picking up patterns. And what science has done, or medical science has done, is created patterns and said, if it's this way, it's a migraine. If it's like that, it's a tension headache. But that's consistently found. So in tension headache, the one consistent finding is the muscle spasm.
Treatment of tension headache?
Very difficult. I think that one must view the treatment of migraine, tension, and the cluster. And there's a fourth one that we should have spoken about, the so-called rebound headache.
Okay.
The one that's caused by taking
pain medication,
becoming a bigger one than the other two. And the first principle, and now we're coming to realize that the first principle in the treatment of these is so-called breaking the cycle.
Okay.
You know, like you said in the insert, 15 days of headache, of muscle tension headache, makes it chronic. Okay. So it becomes from what could be episodic, which means occurs intermittently, to becoming continuous. Once you reach that point, now I just want to finish this point, then you're in trouble. Now the reason we talk about breaking the cycle is what's become very evident from the medical literature is that if you don't treat these headaches early, they form a cycle and they continue, and then it's too late.
And once the cycle has set in,
once the cycle
it's difficult to break.
Very difficult to break. That's when all the so-called unconventional methods come in.
Okay, and we'll talk about that. But anyway, lest she loses interest, we have Charlotte coming from Emela. Charlotte?
Hello?
Charlotte?
Yes.
Good morning. Thank you very much for joining Bonitas House Call. The guests are listening.
Good morning.
Yes, my dear.
I'm actually just phoned in earlier. Just for information, I'm 53 years old. I have never had a headache in my life before.
Lucky you, Charlotte.
But since July last year, tremendous headaches. my head on the right hand, I get earache, toothache, I haven't got teeth, and it is absolutely unbelievable. I had a car accident, and the diagnosis is that I've got arthritis, next, right up the upper neck. And now, whether it's a nerve or what, as I say, it's so difficult for me, and I've got a constant headache.
What are the doctors saying? Have you been to anybody about this headache?
I have been to a doctor twice, and I have been for physiotherapy. The physiotherapy has actually helped with the spasms. But the headaches are always there, but it's on certain times that I just want to put my head to the cushion and hammer it with a hammer on the other side.
With a hammer? Is that what you guys do? Okay.
So that I can balance out the headache.
Okay. Are you on any treatment now? Have you given you any medications?
No, I'm not on any treatment now. I just drink grandpas for the headache.
Okay, fine. Thank you very much for that. Any questions that you want to ask Charlotte quickly?
No, I just want to know if that's caused by the pinching of nerves or what it is. But the fact that the head goes, it goes actually numb.
Okay. Charlotte, just before we attempt to give you some advice, did they do any X-rays or any other investigations on you?
No, I will probably be going for an MR at the end of the month.
MRI scan?
Yes.
And who suggested that? Oh, sorry. The line is not very clear. The line is not very clear. What do you make of it?
It's very difficult, but firstly, somebody who gets their first headache at that age,
at 53,
has got to see a neurologist, number one.
Why?
Why? Because it can be something sinister.
Okay.
And
sinister, something that could kill her?
Yes.
Okay.
Look, it's not common, but at that age, to get your first headache, you have to be seen by somebody who knows what they're doing.
I see.
And once...
And clearly that's not the case with Charlotte, with due respect.
Yes.
I mean, there's too much finder here.
Yeah.
Okay.
Once the neurological examination has shown that there's nothing inside the brain, then we look on the outside. But the first step is obviously to have a neurological examination. And just, Victor, the MRI scan, what we believe is that if the neurologist doesn't see anything, then to go and do an MRI scan is really not going to...
You seem to have a lot of confidence in Professor Moody and his ilk when he says if a neurologist does not pick up anything, there's usually no reason to go and do a very expensive magnetic resonance imaging or MRI scan.
That's what we believe. If the neurologist says, look, there's something or whatever, then we wouldn't, I certainly...
He seems to have a different opinion.
No, it's not a different opinion. I think I want to modify that opinion.
Okay.
I think there's something that's very important and what we call the red flags in headache. So if the person has the same old headache since he was 15 years old, then I would say that he's probably right, that you don't, if the examination by a neurologist is normal, you're safe. But there are important things, like this lady, first onset at age 51, a change in the pattern of your headache, sudden other symptoms associated with
the headache.
When there's a change, you really need to go beyond a neurologist and have the necessary investigations. I mean, I'll give you an example. I was treating a colleague's wife, and for 5 years I said she's got tension headaches, and we used to argue and laugh about it. The 5th year, I almost smacked myself because she popped an aneurysm. No, she burst an aneurysm.
She survived?
So she survived, thank God. But what I'm saying to you is that I must say that what Dr. Shevel says is true, but with the provisos that you are absolutely certain.
Okay.
So I don't think one should say that no investigation is necessary.
From the Northwest, Priscilla.